The heritage of the Sisters of Providence can be tracked back to 1843, to Montreal, and to Mother Emilie Gamlin, who worked with the local bishop to establish a congregation inspired by the spirit of St. Vincent de Paul. In 1861, imbued with the same spirit, Mother Gamlin's successors formed a congregation in Kingston, Ontario. At the request of a local pastor, 4 sisters journeyed from the Kingston congregation to Holyoke, Massachusetts in 1873 and established the House of Providence, which was to become Holyoke's first hospital. Later, in 1892, the Holyoke Mission was incorporated as a separate diocesan congregation, with Mother Mary of Providence as its foundress. The ministry expanded to include hospitals and nursing schools, an orphanage, nursing homes, residences for working girls, daycare, and a home for unwed mothers. In the 1950s, the need to rebuild many of the institutions operated by the sisters was a major concern. Some buildings were more than 50 years old, while others needed to be expanded or modernized. During these same years, the community took steps to provide the advanced education the sisters needed in order to assume significant roles within these modernized, sophisticated health and human service agencies. The health services coalesced in the 1980s into the Sisters of Providence Health System, now comprised of Mercy Medical Center, Providence Behavioral Health Hospital, Weldon Rehabilitation Hospital, Brightside for Families and Children, and a continuing care network that includes skilled nursing facilities, a PACE program, home care, and hospice services. In 1956, the sisters expanded their ministry to North Carolina, and in 1966, assumed management of St. Joseph of the Pines Hospital in Southern Pines, North Carolina. The hospital, originally built as a resort in the 1920s, underwent a transformation. As the need for continuing care evolved, the Sisters of Providence added home care and converted the hospital to a nursing home. The building eventually became the focal point of classic retirement living. Today, St. Joseph of the Pines includes 2 residential communities, an assisted living home, a skilled nursing and rehabilitation center, affordable housing for seniors, and a PACE program. Led by the Sisters of Providence Health System became one of the 3 founding systems of Catholic Health East. We are deeply indebted to the Sisters of Providence for their vision, foresight, and commitment to being one of the architects of Catholic Health East, and for their long history of compassionate concern for those who are poor.